Hi, class. Welcome to another coding workshop. So this is going to be a continuation of yesterday's video. And so we're going to keep on using the practice code pack that I supplied inside of your week 1 resources. All right, so let me share my screen. And I'm also going to do it side by side using my manual and having the coding material or coding scenarios on the screen. All right. There we go. Let me do a little adjustments here. That should do it. It'll give you a full view of my coding manuals. All right, excellent. So let's first start off again, just as a quick little tutorial through your CPT manual. So again, if this is your first introduction to the CPT manual, be sure you review the table of contents, the instructions on how to use the CPT codebook, this is all in the introduction section. Take the time to review the illustrated anatomical and procedural review. This is going to give you a list of specific types of prefixes, suffixes for surgical procedures, prefixes for conditions, suffixes for conditions, directions and position prefixes, direction and position words such as anterior, ventral, posterior, dorsal. These are all great for you. This is exactly what you are learning this week, is about body planes and directions. So again, this is all in the very beginning of your CPT manual. I'm going to try to adjust my camera just a little bit for a clearer view here. So since we're on the topic of suffixes, let's talk about how suffixes relate to surgical procedures. Okay. And so again, if you're in the front of your CPT manual under the introductory section, this is going to be in the lower left-hand column under illustrated anatomical and procedural review. Okay. Understanding prefixes, suffixes, and roots is essential to coding. I'm going to read this straight from the top. It is essential that coders have a thorough understanding of medical terminology and anatomy to code accurately. The following section, reviewing the basics of vocabulary and anatomy, can be used as a quick reference to help you with coding. It is not intended as a replacement for up-to-date medical dictionaries and anatomy texts, which are essential tools for accurate coding. Prefixes, suffixes, and roots. Although medical terminology may seem complex, many medical terms can be broken down into component parts. which makes them easier to understand. Many of the terms are derived from Latin or Greek words, but some include the names of physicians. Prefixes are word parts that appear at the beginning of a word and modify its meaning. Suffixes are found at the end of words. By learning what various prefixes and suffixes mean, it is possible to decipher the meaning of a word quickly. The following list are quick references for some of the common prefixes and suffixes. So I wanted to specifically talk about surgical procedure suffixes. The end of a word, okay? So is typically going to tell you what the action was of the provider. So for example, amniocentesis, okay? Amnio would be referring to the amniotic sac, okay? Centesis is the action of the provider. They're going to puncture the amniotic sac and withdraw or drain or remove fluid. So the action of your provider is centesis, the puncture of a cavity to remove fluid. The location of where that puncture occurred was in the amniotic sac. So you can see in this word here, you've got your physical location followed by the action of the provider. And this is typically how all of your procedural terms procedural terms will be broke down. If you can identify the suffix, break this word down into parts, because every surgical procedure will include the part of the anatomy that the service is being performed on. Okay, let's look at another one. I have ectomy. Ectomy is the surgical removal of something. Okay, so then you're asking yourself, what did they remove? Well, in this example, it is an appendectomy, which means that they remove the appendix. So ectomy is the action, and then your root word is going to be the organ or anatomic site that this service was performed on. Let's look at the next one, ostomy. Ostomy means a new permanent opening. So the example in the book is a colostomy. Colo is colon, okay? That is your intestine. So a colostomy is the creation of a opening in your colon. Think about a tracheostomy. Okay, so again, the word trache is referring to the anatomic site of the trachea. Ostomy would be creating a permanent opening. So someone that wouldn't be able to breathe would need to have a trach inserted, right? So they have to create an opening to put the trach tube in. So again, your procedures will describe where the body location is that the service is being performed on. That's going to be your root or combination form. Your suffix tells you what the doctor's actions were. Let's look at another one. ORAFI. RAFI is suture or repair. So when you see the words RAFI, now you know that that doctor is suturing something or repairing something. And then to know what they're repairing, look at the combination or root word. So in this example, it's a herniorrhaphy. So here you've got the area that is being repaired or what is being repaired, and that's a hernia. And how is it being repaired? By suture. Okay, so herniorrhaphy. Hernio is the location or what they're repairing. Rhaphy is how they're repairing it by suture. Let's look at another one. Opexy. Pexy is surgical fixation. So in this term, nephropexy, nephro refers to your kidneys. Pexy is the action, a surgical fixation. Let's look at another one. Plasty. Notice also, by the way, guys, a lot of these have an O. That's just to make it combining. So if you have nephro, it's the O is the vowel, right? That's what combines your root word or combining words, combining forms with your suffixes, okay? So for the next one, I've got plasty. Plasty is a surgical repair, okay? And then you're asking yourself, what did they repair? Well, if you look in this example here, rhino. Rhino is nose. So now you know they're doing a plastic repair or a surgical repair of the nose, okay? This is always how it's going to flow. All of your procedural terms will include a component of that procedural term will describe the anatomic site or organ or condition that is being serviced, okay? So how they're servicing it, how they're treating or managing it is your suffix. The suffix will always tell you what the doctor did. And then your combining forms or your root words will tell you where that service or that treatment was applied or performed on, okay? Last one here. Tripsy. Tripsy is to crush or destroy. So then you're asking yourself, you almost want to work backwards with these big terms. You may not know the whole word, but if you can start out by identifying what the action of the doctor was, which is always going to be the ending of your term, ectomy, otomy, pexy, raphy, plasty, tripsy. Then you can say, okay, now what part of the body are they doing that to? So work backwards from the end to the beginning. The beginning will tell you what they are destroying. Litho is stone. Okay, so now you know that they're crushing or destroying a stone. So for example, if you had um, kidney stones, gallbladder stones, right? What would be the action of the provider to treat these? One method would be lithotripsy, where they destroy or ablate the stones. Now we talked about suffixes. Let's talk a little bit about prefixes, okay? These are some common, not common, but these are some conditions or prefixes, conditions that you'll find within your CPT manual. A lot of your conditions, of course, is going to come, mainly from your ICD-10 manual. Your ICD-10 manual is your codes set to describe what a patient's condition is. Why are they at the doctor's, right? The procedural terms, the CPT manual tells what that doctor did to treat that patient's problem. All right, so you can see ambi means both, such as ambidextrous. Dis is bad, painful, difficult. Let's see, homo is same, hypo is below, hyper is above, megalo is large, mal is bad. So again, it's giving you some indication of what's where the status, right? The health status of a patient. So for example, hypothyroidism, okay? That is a thyroid that is below normal levels of that hormone. Hyperthyroidism, right? Now you've got a thyroid that is producing too much of a specific hormone, just for some examples here. All right. Here's some condition suffixes. Algia means pain. So again, here you go. Neuralgia. So if algia is your suffix describing what the problem is, then neuro is going to be where that problem is occurring. Neuro is nerves. So now you know that you've got pain in the nerves. Emia is a good one. So example, anemia. The prefix is without, okay? So now you've got a condition in the blood of anemia, right? So emia is blood, anemia. Now we've got potentially deficiency in iron, right? So something is occurring in the blood. Let's see here. Just, I'm not going to go through all of these, but just a couple more here. Pathy is a good one. You'll see this one a lot. So anytime you see, for example, arthropathy, okay, arthro is joint. So now you know where the problem is occurring and what the condition is. Now you have a disease of the joints. All right. Flip over again. Already kind of walked you through this. Refer to this section. This is really good for week 1 because this is all about directions and positions. Take a look at this, okay? This is under list of illustrations. Highly encourage you to take the time to tab your books. It's going to make your life a lot easier. All right, let's get to it. Let's look at number 10 here. So we left off on number 8 on the last video. And I'm going to do some color coding here. So we have an examination of a right hip. And I like this one. There's a lot more story, a lot more content, right? So this is going to allow me to demonstrate how you're going to get forensic, okay, with your coding. You're going to highlight what the anatomic site is. You're going to identify what the service was that's being performed, okay? So I have a little cheat sheet here, and I'm going to use this to guide you along. And I really encourage you guys, again, as you're coding, you want to extract the details from this big story and simplify it for yourself, right? So scrap paper is great, whiteboard even better, right? That way you don't have to keep on finding scrap paper around your house. You can just keep on using a whiteboard. I have one here as an example, but it's too big for the camera. All right. So again, you're always asking yourself, why is the patient here? So that would be the patient's chief complaint, right? Or the established condition, right? So for example, if a patient's here for a surgery, then the problem has already been established, right? We've already determined what the diagnosis or the condition of the patient is. The next question is, again, so now what organ or anatomic site is this condition affecting? Okay. And how is the doctor managing the condition? It's not always a surgery. Okay. So it could be diagnostic. So if we don't know what the patient's problem is, we may need to do an x-ray, a sleep study, do an EKG, right? We got to figure out what's going on so we know how to treat it, how best to treat it. Or is it therapeutic? So is it going to be a prescription, physical therapy, an ultrasound? So ultrasounds can also be used in physical therapy as well. So it's not just an ultrasound for diagnostic purposes. All right. And then lastly, are there any modifying factors? So asking yourself if there's any modifying factors is important because that's going to go back to your modifiers. Remember that. So a modifying factor for radiology would be those modifiers 26 and modifier TC, technical component. So if both services, the X-ray and the interpretation of the X-ray, were performed in 2 separate locations, right? Then you have a modifying factor and you need to build that into your code. And then also, we're going to use this backside. I want to give you guys an example again. When you're in your index, you want to write down your codes or your code ranges, and then you're going to go over to your tabular section, and you're going to have your little cheat sheet here so you don't have to keep on flipping back and forth through your index to your tabular section. All right, let's look at this first one. Examination of the right hip. Ooh, bonus details here. Okay, so diagnosis, primary unilateral osteoarthritis of the right hip. Okay, now I'm going to do color coding here. Your procedures are going to be in yellow. Your problem or diagnosis, okay, is going to be in pink. The organ or anatomic site, I'm going to color code and put in blue, okay? And then if there's any kind of what I'll call back burner, kind of soft, potentially part of the, might have to build out more of the story with these additional terms, I'll kind of use a different color for that. And I'll guide you along the way, okay? So let's look at this. Overview, right hip. A single frontal view is obtained of the right hip. No previous studies are available for comparison. Right hip arthroplasty is seen. Alignment appears grossly unremarkable on this single view. There are skin staples present. Air is seen in the soft tissues, likely due to recent surgery. There appears to be two drains present. The tip of one overlies the soft tissues superior-lateral to the greater trochanter. The second one is more inferior. The tip overlies the right proximal femoral prosthesis. Impression: single view of the right hip with findings consistent with recent total right hip arthroplasty. All right, so here we go. Why is the patient here? We're going to do a single frontal view. It doesn't really tell exactly why the patient's here, but we do have a condition, right? So what we have is primary. Unilateral just means one, right? So one hip, what hip? The right hip. And the patient has osteoarthritis, okay? So that is your problem. Now, the anatomic location of this condition is the hip, not just the hip, but specifically the right hip, okay? So there's modifiers that we can supply RT to further describe that this is just not one hip, but specifically the right hip. All right, so next we've got a details. A single frontal view is obtained of the right hip. All right, so now you've got your procedure, single frontal view of what? The right hip. It tells us no previous studies are available for comparison. Right hip arthroplasty is seen. So basically what they're saying is that they're observing that there's been a recent arthroplasty, which would be a repair of that hip joint. Okay, that's what that term means. It says alignment appears grossly unremarkable. So what you're seeing here, okay, what you're seeing on your screen is the interpretation and report from the radiologist, okay, of what they saw on that image. So filter out the fluff. The fact what the provider saw, right? The skin staples, air is seen, appears to be two drains present. None of this applies to the code you're going to apply, okay? This is just the impression, right? Based off of what they saw on the film, okay? So single view of right hip with findings consistent with recent total right hip arthroplasty. Okay, so what are you coding for? You're coding for the single frontal view of the right hip. So I would go into my index. Now I'm going to go just over to x-rays. And I want to start looking for my hip. Let's see what we find here. All right, so I went x-ray. Now they talk about with contrast. X-ray start on the left-hand column. Again, you're just always looking for your bold terms. So action, a single frontal view. That's what clues me in that this was an X-ray, okay? And then again, type of X-ray, single X-ray. And then everything is listed alphabetically. Now, they didn't say that the x-ray was with contrast. So I'm just going to kind of skim through here and see if I can find some without contrast. If not, I'll just start here and then I'll take it over my tabular section. All right. So I found hip. I found a 73525. Okay, so that's a great starting point. Now, since I'm here, I'm also looking, let's get a little bit more detailed. Okay, so I started my search just by trying to find the anatomic site. Okay, things to point out. So again, notice the first section under x-ray, okay, starts with contrast. Remember I said that I looked inside of our notes and I didn't see anything about with contrast, without contrast. So I don't really, I want to see if there's anything more specific I can get to inside of my index. But this is a good starting point if I don't see anything else in this area that's more specific. So this would be a decent starting point, but I also notice that in the center column, I also have hip. And remember the goal from the index. I want to try to capture as many words as possible that I see inside of my case study. So how about the word unilateral? Yeah, that's kind of important, right? So if I look over here in the right hand, excuse me, not right hand, but center column, I see hip again. I see bilateral. Ooh, unilateral. Now I'm getting even closer to exactly what I need to go review inside of my tabular section. You've got to explore this. You've got to look beyond just one lane, okay? I want you to, once you're in a specific area in your index, right, look for other ways. If you're not finding it from one specific way, you can also guide yourself by asking yourself, okay, what was the anatomic site that was being treated? It's the hip. Let's see if I could also go over to hip. So if you're using your cheat sheet, right? Why is the patient here? Looks like the patient's here for an x-ray. What site? Right? Hip, right? And how is the patient, or how is the doctor managing the patient's condition? So it's diagnostic. They're doing an x-ray. They don't really give us much more information. And then are there any modifying factors? Yes, there are. Remember, this is just the professional component. This is the impression from the radiologist. So what does that mean to us? We're going to have a modifier 26. This is just the report from the radiologist. Okay, there we go. Now, since I'm back here in the index, first things first, before I go to another section, and the reason I'm doing this, guys, is don't drown, turn around. Okay, if you don't find what you're looking for, don't keep on looking in the same section. Find an alternative word from your case study scenario and start there. If you don't find it one way, turn around, take another street, take another path. Okay, so what would be an alternative path? An alternative path would be going to the anatomic site. Let's see if there's anything listed there. I went to hip, and then x-ray. Fantastic. Look at this. Two different ways. So let's say again, you're just not 100% sure of what the service was. Identify the anatomic site that the service was performed on. And then you're going through your list here. The moment they clue you in and say something like single view or frontal view or interior posterior view, or two view, four view, they're talking about an x-ray, okay? And you can see here, hip x-ray. See if I can get this to zoom in a little bit for you there. And then you'll find the same exact codes that we found from the other section. 73501 through 73503. Same thing that you found over under X-ray hip unilateral. Same exact codes. Now I've got my starting point. So now I'm going to take this to my tabular section where my 70,000 series codes are. And before I take you over to the tabular section where that exact code resides at, again, here is one more way that you could kind of just verify or confirm you're in the right area for the service you want to code for. So here's your imaging, okay? And then look how it's broke down. Lower extremities, that's where your legs are. That's where your hips are. And look at the code range, 73501. Oh, that's exactly what we wrote down. You're on track. Okay. So little details that we're going to be looking for when we get over there. Single view. What have I not captured from my index? That's it. Single view. So that's the last little detail I'm looking for. So I'm going to go over to page 542. Look at my range of codes. Nice. 73501 was the first code listed. Radiologic examination hip, unilateral, with pelvis when performed. So when you see things like with pelvis when performed, that means that even if it didn't include the pelvis, you're still going to use this code. They're simply saying that if they said hip and pelvis, it would still be, you would still use the same code. One view, hip, unilateral. Those are the three key words out of that whole story. Filter out the fluff, get forensic. This is what you need. This is all you need to do your job. Okay. What actions and locations? So, what is the location of the condition, problem, chief complaint of the patient? And what are the actions of the provider to treat and manage that condition? Okay. Sometimes you're going to get big, you're going to find yourself in real world scenarios where you're going to have an operative report in front of you or a chart note in front of you where there's going to be a lot of story that just isn't pertinent to you coding your claim. Okay. So again, simplify it by creating a cheat sheet, right, that you can continue to fill out, extract the information you need. So the rest of it kind of just fades away in the background so you can focus on the task at hand. So your final answer is 73501. And remember, this was just the radiologist's interpretation, right? It's when you saw impression, single view right hip consistent with findings of total right hip arthroplasty, that's a clue for you that this doctor's or this radiologist is reviewing a film. Didn't take the film, didn't perform the x-ray, just interpreted it.